Have you ever wondered why something as harmless as pollen in the air, a peanut on a plate, or a tiny insect sting can cause such intense reactions in some people? From sneezing and itching to life-threatening symptoms like difficulty breathing, allergic reactions are surprisingly powerful. And they all begin deep inside the immune system. What's truly fascinating is that an allergic reaction isn't the result of a weak immune system, but rather one that's doing its job too well and aiming at the wrong target. It all starts with the very first exposure to an allergen, which is any substance that can trigger an allergic reaction. This could be anything from tree pollen to shellfish, pet dander, or even certain medications. In most people, these things pass through the body unnoticed. But in someone with an allergy, the immune system makes a critical mistake. It identifies this harmless substance as a dangerous invader. In response, it activates special white blood cells that produce antibodies, specifically a type called immunoglobulin E, or IgE. These IgE antibodies are designed to recognize and bind to that allergen if it ever shows up again. Once created, these IgE antibodies attach themselves to immune cells known as MAST cells and basophils. These cells are found in tissues throughout the body, especially in areas that come into contact with the outside world, like the skin, lungs, digestive tract, and nasal passages. At this stage, the person doesn't feel anything at all. But inside the body, the trap has been set. The immune system is now on high alert, and the next encounter with the allergen will trigger a much stronger, faster reaction. When the allergen enters the body again, say through inhalation, ingestion, or skin contact, it immediately binds to the IgE antibodies sitting on the surface of those mast cells. That binding acts like a switch, causing the mast cells to burst open and release a flood of chemical messengers into the surrounding tissue. The most well-known of these is histamine. It's histamine that causes many of the classic symptoms of an allergic reaction. It makes blood vessels expand and leak, leading to redness and swelling. It stimulates nerves, causing itching and discomfort. And it can constrict airways, making breathing difficult. Depending on where in the body the reaction occurs, the symptoms can vary. In the nose and sinuses, you might get sneezing, congestion, or a runny nose. In the eyes, it can cause redness, itching, and watering. On the skin, you might see hives, rashes, or swelling. If the lungs are affected, it can trigger wheezing, or even an asthma attack. In the digestive tract, it can cause cramps, vomiting, or diarrhea. And sometimes, more than one system reacts at once, leading to more serious consequences. In some people, especially those with severe allergies, this immune response can escalate into something far more dangerous, a condition called anaphylaxis. This is a rapid systemic reaction that can affect the entire body within minutes. The throat may swell shut, blood pressure can drop dangerously low, and breathing can become nearly impossible. Without immediate treatment, usually an injection of epinephrine, also known as adrenaline, anaphylaxis can be fatal. That's why people with severe allergies often carry emergency auto-injectors with them wherever they go. Allergic reactions are, in essence, a case of mistaken identity. The immune system remembers a harmless substance as dangerous and launches a defense as if it were fighting off a real infection. Scientists believe that a combination of genetic factors, environmental exposures, and immune system development in early childhood can all play a role in who develops allergies and why. Despite years of research, the precise reasons why the immune system misfires like this are still not fully understood. But one thing is clear: allergic reactions remind us that the immune system, while essential for survival, is not perfect. It's a powerful, complex defense network that sometimes overreacts, not out of failure, but out of an instinct to protect. So the next time you see someone reacting to a bee sting or avoiding certain foods, know that their immune system isn't broken. In fact, it's doing exactly what it's supposed to do, but just a little too well and for the wrong reason. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends and family, and most importantly, subscribe to the channel for more simple health tips that make a big difference. And while you're at it, tap the notification bell so you never miss out on our latest content. Thanks for watching, and we'll see you in the next video. Stay healthy and keep smiling.